With COVID-19 vaccines anticipated to arrive in Guyana during the second quarter of this year, it is the belief of Shadow Health Minister Dr. Cummings that the government should not waste any more time in ensuring the public is educated on what is expected of the vaccines and their efficacy. In a telephone interview with this newscast on Thursday, Dr. Cummings expressed that encouraging the masses to take the vaccines because they are safe, despite the rumors, is just not good enough. She opined that the elderly, persons with comorbidities, and expectant mothers should all have readily available vaccine information to increase their knowledge of and possibly change their attitudes to the vaccines and the disease that these vaccines can prevent.
What happens to the pregnant women? There are increased risk of preterm birth and all of that. So I'm not sure what has gone into it and communication in terms of risk communication and informing the populace in this vaccine. So we have a lot of work to do.
The Shadow Public Health Minister further opined that it should not only be a government policy for adults to take the vaccine, but medical professionals across the country should coordinate to put educational systems in place before information is disseminated to the public. The Health Ministry has initiated the passage of a new legislation that will provide for the immunization of adults. The draft piece of legislation will be presented to the National Assembly later this year. Minister Anthony has disclosed that although immunization is the anticipated game changer in the fight against COVID-19, adults will not be forced to take them. He highlighted that there will be an opt-out mechanism in place. Since announcing Guyana's partnership with the COVAX facility for equitable access to COVID-19 vaccines in September 2020, Health Minister Dr. Frank Anthony is yet to confirm which of the vaccines Guyana will be afforded. However, more than a week ago, the minister announced that Guyana would receive the first batch of COVID-19 vaccines during the second quarter of 2021. According to Dr. Anthony, the cost of the first set of COVID-19 vaccines for the Guyanese populace will be obtained at no cost to the government, since the Global Alliance for Vaccines and Immunization Gavi will be covering the costs, not only for Guyana, but a number of other countries in the region. Meanwhile, Dr. Leslie Ramsamy, advisor to the Ministry of Health, in a letter to the editor on December 23, called for Guyana to lead the call for an end to inequitable access to vaccines to combat the pandemic. He noted with concern that even as more vaccines are on the horizon, countries that are better off are hoarding doses of COVID vaccines while the poor will watch on with dead bodies accumulating around them. The Caribbean community, CARICOM, has also raised similar concerns and made calls for a global summit to discuss equitable access and distribution of COVID-19 vaccines. Timeka Rodney reporting for the HGP Nightly News.